Enrollment this year is going to run from November 9th through November 20th. And then we ask you turn in all your forms to Jenny by November 20th. And as a reminder, open enrollment is your annual opportunity to elect, change, or cancel coverage. And any changes or elections that you make will take effect January 1st of 2021. But one thing, again, I'd like to reiterate is we ask that you turn in your enrollment forms to Jenny as soon as possible, preferably, but November 20th will be the cutoff. So the agenda for today, first we're going to discuss the medical insurance. And this year we're going to be transitioning from Group Health Trust to the Aspirus Health Plan. And just to provide some quick detail about why we're making this transition is the Group Health Trust delivered a fairly substantial increase to the county. It was about a $360,000 increase to premium rates. And for 2021, that really was not financially feasible. That was not going to fit into the budget. So what we did along with the Oneida County team is we conducted a marketing effort. We went to other carriers and asked them to provide proposals. And through a lot of discussion with these carriers, we decided that it made the most sense to transition to Aspirus Health Plan. For one, to make sure folks can continue to see their doctors, whether or not you doctor at Aspirus, Ascension, or Marshfield. Two, they're competitively priced. And lastly, we actually made some slight plan improvements as well with the Aspirus Health Plan. DBS is going to continue to administer the health reimbursement account. We're not going to be making any changes to the health reimbursement account. But new this year, we're going to offer a health savings account for 2021. And I have a slide to kind of cover exactly what a HSA includes. And then DBS is also going to continue to administer the flexible spending account. Priority Medical Partners, so Dr. Erdman is going to come in and speak to the value that his clinic provides. And then lastly, I'm just going to touch on the dental that's offered through Lincoln and the vision offered through VSP. So earlier in 2020, the county conducted an employee survey. And what we did is we put together everybody's thoughts, had them listed on a sheet of paper, and we pretty much went through them one by one. And what I did here is I summarized kind of the four most common points of feedback that we received. First, employees value Priority Medical Partners. So it's important to make sure that we partner with Dr. Erdman for 2021 like we have in the past. And next, employees mentioned that you'd like to have access to a health savings account. This surprised us because the county hasn't really offered a health savings account in the past. But this year, the county is going to offer the opportunity to employees to participate in a health savings account. And the county is actually going to put money into your health savings accounts if you participate on that plan to help get that program started. Next, we had a number of employees that liked the current plan design, the HRA and the MERP structure. So we are going to continue to offer those plans with the current HRA and MERP structure. And then not surprisingly, I work with a lot of counties and local governments, and this is common feedback. We want a more affordable health plan. So through the high deductible HSA plan, that plan is going to be significantly more affordable for those employees whose main concern is the cost of the medical plan. So on the first page here, we broke out the monthly medical coverage rates. And I wanted to first bring your attention to, you're going to see two different kind of wordings on this page as far as networks go, HMO and broad. So historically, we've offered the Ascension, the Aspirus, and then the broad network. This year, think of it as combining the Aspirus and Ascension network. And we're just going to call that plan the HMO or Aspirus Ascension network. You might hear me use those words interchangeably today. And then we're also going to continue to offer the broad network. And the broad network is also going to include Marshfield Clinic, as well as a few other providers. But in a few slides, I'm going to go through exactly who falls into the HMO network and who falls into the broad network. Most county employees do elect the Aspirus or Ascension network currently. So those employees likely will select the HMO network, I anticipate. But again, employees will have the opportunity to elect the broad network plan. Now, working our way left to right, I apologize, my lights are going in and out. Working our way left to right on this graph or table, excuse me, the traditional HRA plan matches up effectively with that current traditional HRA plan. So think of that as the low deductible traditional. It's the richest plan the county offers, and that's going to be offered in both the HMO and the broad network. Then there's the high deductible HRA plan. This plan syncs up with the current high deductible HRA plan that's offered. And then on the far right, you'll see high deductible HSA HMO and high deductible HSA broad. These are the new HSA qualified high deductible health plan. So this is a brand new health plan that's being offered. And you'll see that this plan on the right is the most affordably rated as well. I broke out the contribution rates below. So the county is going to cover 89% of the traditional HRA plan. They're going to cover 93% of the high deductible HRA plan. And then they're going to cover 95% of the brand new high deductible HSA plan premium as well. And again, as a reminder, the HMO plan includes Aspirus and Ascension, and the broad plan includes Marshfield Clinic too. And in the next few slides, I'll provide a little bit more clarity about the network coverage. But again, these are the rates for 2021, and these are monthly employee rates. I'm just going to pause quick right there. Anybody have any questions just on the rate structure? Okay. So this year we've kind of formatted how the plan designs are illustrated. So on this plan, on these three plans right here, these are the three plan designs for, again, that HMO, which is the Aspirus Ascension plan. And they work in our way left to right. First, we have the traditional HRA plan. Then we have the high deductible HRA plan. And on the far right, we have the brand new HSA plan. So one key change, for the most part, we matched up the current traditional and high deductible HRA plan with the Group Health Trust HRA plans. But one key change on the traditional HRA plan, the low deductible plan, the annual deductible for families, we're dropping that. I believe currently it's at $7,500. That's going to be dropped down to $5,500. So if you're a family on that traditional low deductible HRA plan, you're going to see a decrease in your deductible if you elect that plan again in 2021. So we made that plan slightly richer. But the way that traditional plan works, the individual deductible is $2,750, family deductible is $5,500. We still have 90% coinsurance after you've hit your deductible. And then the annual out-of-pocket maximum for just deductible and coinsurance is capped at $4,000 for individual and $8,000 for families. And then the annual out-of-pocket max when you include your copays is $6,750 for individuals, and for families it's $13,500. And really the only way you could hit those numbers would be if you had, you can only do that through copays. So you'd have to have a lot of copays after your deductible and coinsurance effectively to track up to that annual out-of-pocket max. And all like RX copays, those are going to track toward that out-of-pocket max as well. Primary care specialists and urgent care visits, there's going to be a $30 copay. But for preventative care across all three plans, so if you go in for your preventative visit, there's if you have a mammogram, colonoscopy, those are going to be covered at 100% through this new plan. So they're not, regardless of what plan you pick, as long as you're going to an in-network provider, you will receive 100% coverage for your preventative visits. For ER, there's going to be the $250 copay. And then at the bottom, you'll see the prescription drug coverage between the four tiers of medication. Tier 1, which would be generic medications, there's a $10 copay. Tier 2, which would be preferred brand medications, there's a $40 copay. Tier 3, which would be non-preferred brand medications, there's an $80 copay. And Tier 4, which would be specialty medications, there would be a $100 copay. For the most part, this plan design syncs up for both the traditional HRA plan and the high deductible HRA plan with the current traditional and high deductible HRA plan with Group Health Trust. However, one change obviously is family deductibles are decreasing, which is a positive. And then on the high deductible HRA plan, again, this syncs up with the current high deductible HRA plan that's offered. So I'm not going to wade through all of that. I'd like to focus a little bit more time on the plan on the right here, which is the HSA plan. Now the HSA plan, that stands for Health Savings Account. So this plan is a qualified high deductible health plan that will allow employees to put money into a health savings account. The individual deductible on this plan is $4,000, and for families, it's $8,000. If you're on the family plan though, there's an embedded deductible, which means that one person on the family plan, everybody's going to be subject to their own $4,000 deductible. So if you make the family election on the HSA plan, and someone has a high cost claim, you're only going to be responsible for that $4,000 deductible, where coinsurance would kick in as well, and then up to your annual out-of-pocket maximum. On this plan, I should note there are no copays. So you're responsible for 100% of the cost of your care up until the point where you have met your deductible, then coinsurance kicks in and that would track up to your max out of pocket. So that includes RX, that includes medications and those prescription drug claims. You're responsible to pay for those medications. There is no copays in place until you've hit your deductible, at what point coinsurance would kick in and that would track toward your max out of pocket. However, the county is going to seed a fairly significant amount of money into your HSA plan if you elect HSA account, if you elect this plan, which should help offset the costs of those medications. So I'm going to pause right here. And does anybody have any questions about this new HSA high deductible plan or the current HRA plans that are offered? So one question came in on the chat function. The family, so on the family deductible, that's going to sync up with the limited family deductible on that low deductible traditional plan. So historically, there's been a separate deductible for employee plus one and employee plus family. Those are effectively now going to be the same at $5,500. Another question, what if a specialist isn't offered in network? So that would be an example if you're on the HMO plan and then you don't have a specialist in the Aspirus or Ascension network. If you are referred out of network by an in-network physician, that will be processed at in-network benefit levels. So let's say you select the HMO plan, which has Aspirus and Ascension. This actually happens fairly frequently where, for example, like Aspirus wouldn't have an in-network provider. They'll make the referral out to a non-network provider, like a provider at Marshfield Clinic who wouldn't fall in this network. You'd still receive in-network benefit levels. I would just recommend that you reach out to Aspirus Health Plan, the new health insurance carrier, and notify them that that's the case, just to make sure there aren't any issues with processing that claim. Does a traditional Aspirus Ascension plan work the same as it has in the past? Yes. So the traditional Aspirus Ascension plan, it works. The setup is the same as it has been in the past. The annual deductible is just, for families, is just going to be a little bit lower. Another question come in here. What is the benefit of having an HSA plan if you have to pay for everything yourself? So the value of the HSA plan, first off, it's significantly cheaper. It's a third of the cost for you to be on that plan compared to the traditional HRA plan. And another value is the county is going to, we'll get to this in a few slides, going to seed significant funds of amounts of money into your HSA plan, which is another value benefit. And lastly, HSA plan is a great retirement savings vehicle with a health savings account. That is a benefit as well. See, we got a couple. These are good questions. Is UW Clinic Hospital still under the traditional plan? I'm going to tackle that in a few slides. So with the HSA plan, we got the question, no copay for meds of the $10 example below. That's correct. So for example, if you're in the $10 copay, that likely means you're on a generic medication. On the HSA plan, you're going to have to pay the full cost of that generic medication as well. We'll discuss that again in a few more slides because I do have some RX questions. Someone asked, I have 3 people in the family. What is my actual deductible? What did you mean by hidden charge? If you have 3 people in your family, you would be subject to the family deductible right here listed on the second column. And I think we got one more question. What happens to the current HRA balances? That all is going to stay the same. So you're not losing any of your HRA balances. Those are all going to stay the same going forward. All right, I'm going to keep moving forward just because I think we'll have some slides upcoming that will answer some of these questions that are rolling in. But if you elect the broad network plan, this is set up the same as the HMO network plan. So these plan designs are the same. However, there's also out-of-network coverage on the broad network plan. In the broad network, that also would include Marshfield Clinic. So think of this plan as effectively the same as the HMO plan. However, there is out-of-network benefit levels. That would be if you chose to go out of network. But on the broad network, this is pretty much going to include all providers in the area. So it's going to be difficult to find an out-of-network provider. But Again, the family deductible is lower on this broad network plan too. All right, so the Aspire, we had a couple questions about the network setup with the Aspirus Ascension HMO plan. And so the Aspirus Ascension network, it's going to include these hospitals listed here on the left. And we got the question before if UW Health is in the Signature network or in this HMO network. And the answer is yes, these providers will be in the Aspirus Ascension network, as well as the independent provider affiliates listed here on the right. So again, the focus of this network is Aspirus and Ascension. However, if you are outside of Wisconsin, let's say you're traveling, let's say you're an emergency, you have access to the First Health Network. So we actually had the question about, is Mayo Clinic over in Rochester in the Signature and in this HMO Aspirus Ascension network? And the answer is yes, they are, because when you're outside of the state of Wisconsin, you have access to what's called the First Health Network, which is just a national network, and Mayo Clinic over in Rochester, that is in the network. And if you are in an emergency and you have elected the HMO network, regardless of where you go, like regardless of where an ambulance would take you, those benefits would be processed at in-network benefit levels too. So that's a key point as well. We got a couple questions roll in here. Is Marshfield Clinic considered in or out of network? Marshfield would be out of this network. Marshfield Clinic is in the broad network though. So you can elect the broad network plan and then you will have Marshfield Clinic in network. Another question is, what if my family or myself are out of the area in Ascension? I think we answered that. If you're out of the area, you'll have access to the First Health Network, which again is a broad national network. Especially outside of like this core service area that's listed here in the dark blue. But you will have access to an in-network provider. And lastly, do office visits get applied to deductible or traditional and high deductible? So office visits on the HRA plans, this is back to a few slides ago, aren't going to track those copay costs, don't track toward your deductible on those plans. However, office visits do track toward your deductible on the HSA plan. I think we got one more question here. Can Mayo Clinic in Rochester be my primary care provider? Yes, it could. So you can doctor there. They are an in-network provider. So as long as that is your primary care provider out there, at the Mayo system, the Mayo system that would not be in network in this HMO network would be, there's some Mayo affiliated clinics over on the western side of the state. Those are not in this network, but if you are the Mayo over in Rochester, yep, you're okay. That's your primary care provider. These are great questions. Keep them rolling in. There is a list of prescription drugs for each tier. We'll provide that. And how do you check if a private doctor office is in network? What you can do is you can use, if you go to Aspirus Health Plan, find a doctor tool, you can search by network. So you can elect this HMO network, or you can elect the broad network and run a zip code search. And that will provide you information of if your independent doctor would be in network as well. You can also search by that doctor's name. What we're doing is Aspirus Health Plan is going to be hosting a meeting similar to this. It's going to be a recorded presentation. They're going to go into far more details about how to find a doctor, some of their value-added resources as well. And we actually have a contact directly at Aspirus Health Plan that employees can reach out to. So I think that will be a good resource for you to utilize. And I don't know if that recorded presentation was sent out quite yet, but if it hasn't, it's going to be coming out here shortly too. But they'll go into a lot more detail about resources, finding a doctor tool, things like that. So the next slide here is the broad network. The broad network, it can also be called the Freedom Network. The key additions to this network are the Marshfield Clinic in the area, and also the Mayo Clinic Health System in the state of Wisconsin. So again, if you're outside of the state of Wisconsin, you doctor primarily at Mayo Clinic over in Rochester, you're fine. They're in either network, the broad network or the HMO network. But for this network, I think the key difference between this network and that HMO Aspirus Ascension network is that Marshfield Clinic is in this network. Another question. If someone picks HSA, are they able to still have HSA or FSA? We'll tackle that in a few slides here. A great question. So again, the key differences between the two networks, this Freedom Network, or the broad network as we call it, it will include the Marshfield Clinic system. So if your primary care doc is in the Marshfield Clinic system, you have the ability, like you do currently, to elect the broad network. It is a little bit more expensive. However, you will have the opportunity for your primary doctor to be in the Marshfield Clinic system. And again, through this network, we have access to the First Health Network, which is their broad national network for traveling out-of-state providers too. Great questions. All right, and here is the Find a Doctor tool. So to find a doctor, go to this URL listed up top. You click Find a Doctor, and then you're gonna have the opportunity to select between two networks. If you wanna jot this down quickly, the Signature Network, that is their terminology for their Aspirus Ascension HMO network. And then the Freedom Network, that's their terminology for the broad network. So this is how the tool that you can use to find an in-network provider. To answer, we had a question before about if an independent doctor was in network. This is the URL that you can use to identify if somebody is in or out of network. Prescription drug coverage, we're going to be changing from CVS. I think this will certainly be a positive change over to Navitus. Navitus is going to be the new pharmacy benefit manager effective January 1st. Pretty much all major pharmacies are in Navitus's network. You can see it listed on the right side here in the kind of the yellow colored box. If you are currently on a step therapy, or if you've already gone through a step therapy requirement, that requirement is going to be waived with Navitus. Anybody currently receiving a medication that would require prior approval, that requirement is going to be waived for the first 90 days. So it should be with Navitus, we've basically done everything. We put everything in place to make this a smooth transition. Another key is that you're not currently required to use mail order to fill maintenance medications. That's not going to be the case. You don't have to use mail order to fill your maintenance medications. And what I think will be the easiest process, certainly if you have any questions, reach out to Jenny or myself on specific medications and we can help get those answered. But once you get your new ID card, if you elect this plan, I recommend providing that ID card to your pharmacy and also to your doctor that has prescribed the medication, just to make sure it's a perfectly seamless transition over to receiving your medication, especially if it's a maintenance medication on the new plan with the Aspirus Health Plan. But I think to summarize, this is going to be a positive change. CVS necessarily, they're not always the simplest pharmacy benefit manager to work with or the most user-friendly. Navitus, I work with Navitus. They do a great job, provide good customer service, and they'll really make for a seamless transition as well. Again, I think through the recorded presentation that's going to be sent out by Aspirus Health Plan, he'll be able to go into a few more details about the prescription drug transition. But any questions on the prescription drug change? All right. There will be telehealth offered. It's going to be offered through MD Live, and historically it's been offered through, whoops, we had one question in quick. Does health insurance cover one eye exam per year per person as preventative? Let me verify the eye exam coverage. I do believe they cover one preventative visit, but let me just make sure I'm not speaking out of turn. I'm going to answer that question. Do you know if CVS will forward OpenRx to Navitus? So no, they're not going to forward the OpenRx. So like if you're not on an ongoing medication to Navitus, that's why we recommend that you provide your new information to the pharmacy. There shouldn't be any issues. Like if you're on a medication, you'll continue to be able to likely get that medication through Navitus. It's just more so a matter of you making sure that the pharmacy has the right ID card on hand so that they can process that claim. But there shouldn't be any issue with transitioning medications from CVS over to Navitus. But that's the process that I recommend, is certainly providing your pharmacist with that ID card. So with telehealth, we're going to be transitioning from Teladoc over to MD Live. They offer pretty much the exact same service as Teladoc. If you are on the traditional copay plans, the low deductible or high deductible HRA plan, there is going to be a $10 copay for general health visits through MD Live. If you're on one of the high deductible HSA qualified plans, there's going to be a $50 copay because the rules for high deductible health plans is you can't have a copay in place that decreases the true cost of the care. So you're required to pay the full cost of the visit, which is $50. I would say though that these visits on the copay plan, these are certainly lower copays than having a urgent care office visit. And even for the high deductible health plan, $50 is going to be significantly cheaper than what the cost would be if you'd go in for an in-person visit as well. Any questions on the telehealth? And you can see on this slide a few more counseling, psychiatry, and then dermatology as well is all going to be covered. They're subject to different copays too. Psychiatry, excuse me, I butchered that word. Next slide then. So we had the question earlier, are we going to be making any changes to the health reimbursement account? No. The single, the employee plus one, and the family health reimbursement account and the MERP is going to stay the same. So no changes will be made to the single employee plus one or family HRA or MERP plans. We did slightly change up the illustration, and specifically on the family plan, we're decreasing the deductible for families on that plan. So we did need to make just some slight tweaks to the illustration. However, you will be able to still keep your HRA unused portion. That will continue to remain with you. Question roll in. Does the high deductible health plan include provider negotiated discounts? Yep, that's a great question. So if you elect the high deductible HSA health plan, you will still be subject to all of the provider negotiated discounts from the health plan. All right. Slide here, the high deductible HRA plan. So again, no changes to the high deductible HRA. Again, this is the health reimbursement account that's administered by DBS. There's not going to be any changes to this plan either for singles, employee plus one, or families. So again, no changes to either of the HRA plans. We wanted to keep those plans set up the same. We wanted to continue offer to folks the HRA being able to roll over that amount annually too. So new this year, the health savings account. A health savings account, it allows you to put dollars away pre-tax to spend on qualified medical, dental, and vision expenses. All funds, every dollar in this account is yours. It's yours into perpetuity. If you're ever to leave the county, if you're to retire from the county, you have access to 100% of funds that are in your health savings account. And again, you can only participate on this plan if you elect, the most affordable HSA high deductible health. It's triple tax advantage. So you're not taxed on the money you put in. You're not taxed on the investment income you can earn in a health savings account. And you're also not taxed when you use those funds on qualified medical, dental, or vision expenses. And once you retire, you can use HSA funds for Medicare premiums, expenses, dental vision expenses, and you can also withdraw your HRA funds after age 65 with no penalty. So a health savings account is actually a really good retirement saving vehicle. That's what we see it used for. And I personally participate in a health savings account. My company does a match similar to what Oneida County is going to do. And then I also input more dollars into my health savings account. And I don't go to the doctor often, but I just know I have those funds in my back pocket in the event that I would have a claim and I would be subject to pay the costs of the services. The maximum HSA contribution limits for 2021 are $3,600 for singles and $7,200 for families. And the HSAs are going to be set up through Associated Bank, and there's going to be more details to follow with just the logistics of that setup. We have a question rolling here. Can HSA funds be used to pay for long-term care insurance? So long-term care, I think that would be like long-term care insurance premiums, I want to say. No, so you can't use the HSA funds to pay for the premiums for long-term care insurance, I believe. Or is it? Is a $1,000 catch-up allowed for 55 plus? What if you turn age 55 in 2021? Yes, it is available. So if you're age 55 or older, that's a person who really is familiar with HSAs. You have access to an additional $1,000 catch-up contribution. And in the year, if you do turn 21 in that year, you are eligible for the $1,000 catch-up contribution. Because HSAs, they just run on the tax calendar year from January through December. So you would have the opportunity once you turn 55 to input another $1,000 into your HSA. Another question: are the provider negotiated discounts the same across all plans? Yes, the provider negotiated discounts are the same between either HRA plan and the HSA plan. So HSA, it's an incredible savings vehicle. It's a savings account. So it's not like an HRA or MERP or flexible spending account, because those all have language that says, it's you use it or lose it in a given year, or you don't retain all of the funds. Any fund that's in your health savings account is your fund until you spend it or you withdraw it as well. But as a reminder, if you participate on the high deductible HSA plan, you are going to be responsible for the full costs of services up to the point where you've met your deductible, where co-insurance kicks in, and then you're maxed out of pocket. What about existing HSA accounts at a different bank? Can they be used? Now, I'm going to have to verify that. So the question was, if you have an HSA, maybe you brought it from a different employer, can you use that at the current, we're making the move over to Associated Bank? I believe, let me verify that with Jenny and Lisa if we're going to allow that going forward. So yeah, I wanted to just touch base with that. And one other, I had a quick note on my team. So I misspoke earlier. So for long-term care premiums, so for long-term care insurance premiums, you can use your HSA funds. Like, let's say you have a built-up HSA account balance, you can use that to pay for the premiums for the long-term care insurance ongoing. No other bank. So we're not going to be using any other banks than Associated. The HSA account that is administered through the county, that's all going to be administered through Associated Bank. So you can certainly use those HSA funds from your other bank, but the county's HSA program is going to be administered through Associated Bank. Just got clarification on that. All right. And if you have any HSA questions, you can feel free to steer them my way. I want to make sure that we get to give Dr. Erdman some time before he has to get back, but let me just check how we're doing here. So the 2021 health savings account contributions, Oneida County is going to be, if you elect that high deductible HSA plan, and this is going to be the amount that the county is going to deposit and also match in your HSA contributions. So if you're a single employee and you elect that plan, there's going to be a one-time contribution from the county of $500, also a $500 annual contribution, and the county will match, assuming you also deposit some funds in your HSA accounts, up to $300. So the maximum that you can receive from the county putting in your HSA on a single plan is $1,300. That's not to say though that you couldn't take the savings from being on that plan compared to being on one of the more high cost HRA traditional plans and use that to put in your HSA. The limited family, the county will seed up to $2,350, and for full families, you have the ability to receive up to $3,400. And for example, for families, the county is going to do a one-time contribution of $1,000, an annual contribution of $1,500, and then the county will match up to $900. So if you wanted to take full advantage of this, you would need to, of the county match, for example, and you're on a family plan, you would need to deposit $900 of your own payroll into the county, be payroll withdrawn to have it take advantage of the county match up to $900. There's going to be significant savings though if you elect the family high deductible HSA plan compared to the traditional HSA plan. We just had a question roll in here. Yeah, and the one-time contribution is for 2021 only too. So that's a key point, something that you'll be able to take advantage of this year. I'm not sure if we're going to be able to continue to do that in future years, but again, a one-time contribution. This is for 2021. We're not exactly sure what the contribution, what we'll be able to see it again in 2022, but we really just wanted to help employees get up and off the ground with their HSA programs. So
him. Hold on 1 second, everybody. I think we might have lost Jacob. Yep, he must have. Lisa, are you still there?
Yeah, I'm still here.
We lost Jacob. Okay, hold on 1 moment, everybody. We'll get Jacob back on. Okay, well, while we're waiting for Jacob to get back on, a couple things that I wanted to note. So as Jacob had said, forms are going to be due November 20th, by November 20th. I wanted to clarify that, oh, there's Jacob. I wanted to clarify that you are able to email forms. We do not need the original forms from you, so you can feel free to drop them off at LRES, but feel free to email them. All right, I think we have Jacob back on, or do we? Jacob, are you there?
Yep, I apologize. I got booted off for one reason. We got another question on HSA. Can you explain the $1,000 catch-up again for 55 or older? As long as you are age 55 and older, you have the ability to put $1,000 of a catch-up contribution in your HSA annually. So when you're 55, 56, 57, every year, you can put an additional $1,000 in on top of the federal maximums that I listed on a few slides earlier. And the last question was, so the HSA is only available with the high deductible plan. That's correct. The HSA is only available if you participate on the high deductible HSA plan. It's not available. The government dictates the setup of these HSA plans and what plans they can be paired with. And you can't have an HSA plan in place if you're on an HRA plan or on an FSA plan or on a plan with copays. Do you have to do a lump sum to contribute to the HSA, or can it be distributed over a few paychecks? It can be distributed over a few paychecks. It actually will be distributed over a few your paychecks throughout the year. So let's say I say I want to deposit $1,200 into my HSA account this year. Every month $100 is going to be deducted from my paycheck and then input into my health savings account. Yep, that's a good question. So this is my last slide, and then I'm going to hand it over to Dr. Erdman. But the flexible spending account, this is only available to employees that don't elect the high deductible HSA plan. So just to be clear, if you elect the high deductible HSA plan, you can't participate in the flex spending account. Your HRA funds will continue to be carried over, but you're not going to have access, obviously, to those HRA funds while you're an active employee participating on that high deductible HSA plan. The 2021 FSA contribution limit is $2,750. HSA funds, a reminder, are use it or lose it, but the county does allow for a carryover of unused funds. FSA deductions are taken pre-tax, and you can use unqualified medical, dental, or vision expenses. So the FSA fund, there's really not going to be any changes to the rules for flexible spending accounts. And one change, though, is in 2021, the county is going to offer a limited flexible spending account. So if you participate on the HSA plan, the high deductible HSA plan, you have the money in the HSA, the government says you can't use FSA funds. Now, if you have a rollover FSA balance, I'd certainly recommend using your FSA balance prior to the end of the year. But if you do have a remaining balance, since the county does allow for a carryover, we're going to convert those FSA funds that you currently have into what's called a limited FSA. In a limited FSA, it can only be used on dental and vision expenses. Can't be used on medical, but again, that you'll be able to continue to have money in that account and carry it over if you can't use it in the given year. And also, if you participate on the HSA plan, the high deductible HSA plan, you can also open up a limited flexible spending account. And again, a limited flexible spending account is, think of it just as a flexible spending account that you can't use on medical. You can only use it on dental and vision expenses. So again, that's how the process is going to look for if you want to transition from one of the accounts and you have an FSA plan open over to the high deductible plan, only if you're carrying over balances. You certainly don't have to elect the limited flexible spending account if you just want to put funds into your health savings account. So I have a few questions. I'm going to answer these and I'm going to hand it over to Dr. Erdman. So what is the maximum contribution for HSA for an employee plus one? The maximum contribution would be the $7,200 right here. Yep. So if you have more than just yourself in the plan, you can seed up to $7,200. All HSA deposits, they're going to be biweekly with payroll. And yep, and someone noted the Oneida County limits the FSA to $2,700. So there might have been a typo here. Yep, so the current FSA contribution is $2,700, not $2,750. Yep, I'm going to provide the slides of the presentation. This is also recorded. And that being the HRA can carry over, where can we find out how much we have carried over the years? So DBS provides that information. I'd say if you want to know how much HRA balance you have, I'd probably recommend reaching out to Jenny because I don't have access to that information. DBS has access to that information too. I'm going to turn it over to Dr. Erdman here, but if you have any questions that you think of, I'm going to come back on after he presents and feel free to steer those questions my way as you think of them. Thanks everybody. And Dr. Erdman, I'm going to hand it over to you now in 1 second. So we're going to cover the dental and the vision insurance coverage, but I just want to kind of like open up the floor, I guess, to questions, just because I noticed when I've asked questions, usually the questions follow the slide before. So feel free to ask me any of those questions. But one kind of quick summary of, Dr. Erdman's presentation, especially if you're on the HSA plan, you'll have access to, it's going to cost you less. Usually if you're going to go, let's say for like an urgent care visit, it's going to be more affordable for you to go to Dr. Erdman's clinic than go to an Ascension, a Spirus, or a Marshfield provider. If you do though, let's say you do for your like preventative visit and you want to go to see your primary care provider and that's not Dr. Erdman, that will be covered at 100% for what's considered preventative. If there is any cost on top of the preventative visit, you can certainly use your HSA funds. And one thing that I always do when I go to the doctor is you can ask them, is this going to be covered as a preventative visit? And because you go to the provider and, pretty soon they have labs, lipid panels, things like that. Those aren't going to be covered. They don't necessarily just tell you that they're not going to be covered at 100%, but it certainly does not hurt to ask. So no changes to the dental coverage with Lincoln. The plan design is going to stay the same as it currently is. The rates also, we did receive a flat renewal too. So there's going to be no rate increase for employees on the dental insurance coverage. And then on the vision insurance coverage as well, we have a rate lock in place in the vision insurance coverage. I've included the summary plan design here. I would just say my one plug for vision insurance is if you have glasses or contacts like me, I contribute the relatively affordable monthly employee rates. And then I just take advantage of the lenses, the contact lenses benefit every year. And you can use your HSA funds on glasses, lenses, frames. You can use your HSA account for those qualified vision expenses too. So that's a key point. Like for example, for my contact lenses, I know that they usually cost more than the $150 allowance that you got on the plan. So I pay that remaining balance with my HSA funds that I put aside as well. On this last page here, I included my contact information. I also included Dr. Erdman's contact information, but I'm just going to pause. Do we have any questions about anything that was covered today? Including back to the health reimbursement account, flexible spending account, health savings account. I know there was a lot of information that we covered, and it's probably going to take you a while to kind of absorb, I'd say, everything that we covered today. But again, this presentation is going to be recorded, and pretty much all of this information is also included in the benefits guide that was provided to all employees. You said HSA funds can be used for vision. Can HSA funds be used for dental? Yep. HSA funds can be used for any qualified medical, dental, or vision expenses. So for example, if you have a filling, you can use your HSA account, your HSA funds to cover the balance, because your dental plan is only going to cover 80% of the filling. So you have any qualified medical, dental, or vision expense, you can use your HSA funds on. So it's pretty nifty. It's a great benefit, something that the county hasn't offered in the past, but it was clear that there were a lot of employees that wanted to take advantage of that plan and be able to use an HSA and put money into an HSA as well. Any other questions? I appreciate all the questions that came in. I mean, there's a lot of times I do these presentations, I'm just talking to a screen. I'm wondering if anyone's even listening to me. So I appreciate the questions that came in. With that, I think we can wrap up the meeting, and Jenny can press recording when I'm done here. But first off, I wanted to thank everybody for participating, taking the time to watch this presentation. And also thank you as we work through this transition. We know it's not simple for obviously, Lisa and Jenny and obviously the employees to go through a transition like this. But we just really appreciate, working with us through this transition. We've really done our best to try to improve the program that the county offers and make it as affordable as possible to employees too. So with that, again, thank you very much, and everybody have a great rest of your day.